Hi, me again with another gloving video. For anyone who works in the medical field, be it human or veterinary, you should be familiar with the term closed gloving. Many people will tell you that it is far simpler than open gloving, and I agree, because there isn't a concern about touching a non-sterile surface of the glove when manipulating them onto your hand. Once again, I will be using my funky green neoprene gloves because of my latex sensitivity. Also, I don't have a surgical gown with me, so I'm using this sweater that has nice elastic cuffs, similar to those on a real surgical gown. So just use a little imagination and bear with me while I do this. So, once again, this is my checkerboard sterile surface here, and we have our gloves. And unlike the open gloving, when you are closed gloving, your hands do not come through the cuff of the gown once you put it on, so your hands stay like this. So because of that, you are free to touch this glove pack anywhere you want. You're not just limited to below this black line because the gloves are sterile and your gown is sterile because it has to be autoclaved before you wear it, so sterile can touch sterile. And that is sort of the key thing about this gloving, and that's where a lot of people get mixed up because they are stuck in the whole mentality of the sterile versus non-sterile when doing open gloving. But closed gloving, you don't need to worry about the non-sterile versus sterile, as long as you're, doing it properly. So, here we go. So here's the gloves, and my hands are in the cuff here, so you can touch this anywhere you want to open it up, provided your fingers don't sneak through. Oops. There we go, and once again, left and right. You can open it any way that gets it open. So, it's a little different to put the gloves on this way. Let's tip that up a little bit. So, what you want to do is grab your first glove, and because I'm left-handed, I grab my right first, but you can grab whichever glove you want, but make sure you are pinching through the cuff, not with your real fingers. And you want to pick it up and lay it opposite on your other hand. And a neat little trick that we say at school is thumb to thumb, palm to palm, fingers up the sleeve. So, once again, when you're picking it up, you pick it up and flip it so it's backwards on your hand. And so from here, what you want to do is pinch the one side of the cuff. And this is a little more difficult because the sweater is thicker than a surgical gown. However, I will get it. And okay, so there. So without touching with your fingers, you want to grab and just stretch it over the cuff. Now remembering your gown is sterile and your glove is sterile, so you can touch it anywhere you want. And once you've got that on, just pull your fingers through, and one of the difficult things is sometimes your thumb gets buried in between the glove and the cuff of the gown. So you just gotta work it out and just pull it on like that all the way around, right up the top of the cuff so that none of that elastic part of the cuff is showing. And so it's on there. And because your gloves are completely sterile and you haven't touched it with your actual skin, you don't need to worry about not touching this cuffed part. You can touch it and you can manipulate your hand more. And see how that would roll normally? You can just grab that cuff with your hand and stretch it all the way on to your gown so that it's all the way on, and you can go on to getting your other glove on. And once again, this cuff has not been touched by your non-sterile hand, so you can actually pick it up and touch it. And same method, thumb to thumb, palm to palm, fingers up the sleeve. So, grab one side, pinch with the other and stretch right over the cuff, and you can touch this glove any which way you want because you are sterile with this hand. And once again, my thumb is buried between the cuff and the glove, so it's just a little bit of work to pull that on, squeeze out 2 fingers in 1 finger hole, and just pull it on like that. Keeping in mind that sterile can touch sterile, so there is no risk of touching an unsterile surface. And just reefing it up your arm there with that twisting motion. And then once you're on, you can see sort of how the glove comes all the way up to here. It's kind of bad lighting, but the glove or cuff here is there, so it's a little uncomfortable. So because the surgical gown is sterile and your gloves are sterile, you can touch and pull and adjust that inside gown cuff to however you feel most comfortable. And believe me, when you have a cuff that high up on your hand, see how it's folded in there, and when you're in surgery for, half an hour or 40 minutes, it gets kind of uncomfortable. So, there. Closed gloving, as you can see, is faster and far more easier than the open gloving, but once again, it's something that does take practice, and before you can do it properly, you have to know how to gown and scrub. So this is sort of step 3 in the process of getting ready to go into surgery. However, always the most difficult tasks are putting the gloves on. So I hope you found this video helpful. Comment and tell me what you think, and have happy gloving.